Countries all over the world ordered nationwide lockdown due to COVID-19 outbreak. The cities are filled with coronavirus terrorizing the streets to infect everyone on their way. Businesses have been shut down. People are staying at home, waiting hopelessly for a solution. The world wants to return to their normal lives quickly. But how realistic is it?
When the world is going through a difficult time, we are all really looking for the answer that when exactly this COVID-19 is going to end. We all want to know that when exactly there will be end of this dark time. However, the world is claiming that we are going to see the end of this time very soon. Maybe in August 2020 or September, we are going to see this first vaccine for COVID-19. How much it is authentic, how much it is really true, because we know that normally a vaccine takes 4 to 5 years to bring up in the market. So how these people are so confident and how exactly it is going to happen this time. So I'm going to answer all your queries in this video. Hi, I'm Pramak Das. I'm an international trainer and a motivator, and I always try to bring such informative video so that you are always getting the right information and staying ahead and living a positive life. So if you have still not subscribed my channel, it's time for you to subscribe this channel so that you are always ahead in your life and you stay ahead in everything. And please click the bell button to get notified for such interesting and informative videos. So let us get into the topic. So we basically need to understand that what exactly this vaccine is all about. So first of all, I'll tell you that what this vaccine is all about. A vaccine is a way to develop an artificial immunity for the body. Now, what is immunity? Immunity is a kind of body's self mechanism or a defense mechanism which is automatically making our body safe and secure against any foreign elements when it attacks our body. So whenever we fall sick, we always get infected, we get exposed to the foreign elements, which could be a microorganism, which could be a virus, fungi, or a bacteria. So our body has got our own innate immunity which always fights with that foreign intruder to defeat it. And if it is not successful, then it has got a second part of the immunity which is called as the adaptive immunity, which is stronger, and it really creates some antibody for this specific virus or the specific bacteria and any other microorganism, and automatically immediately defeats that. But let me tell you that how exactly it is done. Generally, in case of vaccination, our body is always created a kind of immunity. Now, in order to create that immunity, it's not a one-day process. So first of all, we should understand that how it is brought to your body. So generally we'll see that a part of the pathogen is introduced in the human body. So it takes several days time, which could be 1 week, 2 weeks, which could be 2 months, even 3 months time to bring that immunity. But it doesn't happen overnight. But it is done by introducing a part of the pathogen in the human body, and it is never possible to introduce a complete pathogen into the body because the body structure and that structure of that microorganism or the pathogen is completely different. So we always introduce a part of the pathogen. Now you may ask me a question that if the pathogen can fall us sick, then how exactly we're introducing in the body and we do not fall sick? In case when we do the vaccination, we always inactivated that part which makes us fall sick. So there are no chances of falling sick by that body. Rather, it strengthens our immunity internally with time. Now, what happens when we introduce the vaccine? Our innate immunity starts immediately working to defeat that particular pathogen or that foreign element. Now, most of the time, the innate immunity fails. And when the innate immunity fails, it immediately calls the acquired immunity or the adaptive immunity of the body, which try to create the antibody. Now, this antibody is a kind of protein which binds with that particular pathogen or that foreign element, and it immediately defeats it. Now, once it goes out of the body, it creates some memory for that particular foreign element or that infection, so that the next time when the body is again getting exposed to the similar infection, it will immediately trigger that antibody and it will immediately defeat that particular foreign element or that virus or bacteria. So this is how the vaccination happens. Now there are classic 3 types of vaccination which is normally known to us and which are very famous. That is the inactivated vaccination, and then we have got the live attenuated vaccination, where we basically try to attune a particular part of the live microorganism in the body, And the third one is basically where we introduce a subunit or a part of the pathogen in our body. Now, for this COVID-19, there are some new techniques of vaccination which are also coming in the market very soon. So we are already working on the DNA vaccine, where we are genetically engineering the particular strand of the virus, which basically can really fight with the virus. At the same time, we are also bringing RNA vaccination, and we are also bringing something called as vector virus, or this vector virus are basically more popular in the recent time. So if we talk about the recent research which is done from the Oxford University, one of the classical university of the world, then they are in collaboration with AstraZeneca. They are working on ChAdOx1 COVID-19, which is basically a kind of chimpanzee adenovirus. So this particular virus is a very common in the chimpanzees, which causes cold and flu, and it is tested that they are working on that particular virus, and they can see that very soon they can bring their vaccine. Now, normally this kind of vaccines take years of research and years of trial to make sure that they are safe for human. But how come the companies and the world are so confident, then they can say that this vaccine is going to come in August 2020, when the world has just seen COVID almost in the last year. However, from March, the entire world has come to know about this virus. So how soon we can see this vaccine coming in the market? So for that, you have to understand that what exactly is the process of bringing a vaccination. A vaccination is basically done, as I said, in normal 3 conventional ways. But apart from that, it takes years of research. So there are normally 7 stages of bringing a vaccine in the market. The first stage is called as the preclinical research. In the preclinical research, they study the biological nature, the structure of this virus, and they understand that how exactly this particular microorganism is working. And on the basis of that, they decide that what will be the approach of defeating this virus and how exactly they are going to work. So in this case, we take normally few years to work on the preclinical research, and then comes the phase 1. In this phase 1, when they already know that they are going to work this particular new vaccine on a controlled environment, where normally 20 to 80 people are being given this virus, and they want to see that what exactly are the changes, how they cope up with this particular vaccine, and what exactly are the results. And once they are successful, they always try to use it in the second level. And in the first trial, they always do it in the animals. And if they see that they are successful, they always go for the human trial. But in this case of COVID, we really are running short of time. So we can see that many people have volunteered to come for this vaccination. We really appreciate their confidence and the kind of great attitude or the kind of sovereignty they have shown to help the mankind. But we should always understand that this process also takes several years of research. And in the second phase, they introduce to around hundreds of people who are basically coming from varied medical backgrounds, like diabetic patients, people with cancer, and other infections, so that we can see that how really it is working on them. And once we are sure, it moves to phase 3, where we can be very confident of using it more than tens and thousands of people. And once we are really through the phase 3, the question comes that we should go for the approval. And that approval normally comes from the nodal body of the government. Like in USA, it comes from FDA, which is unlike CDC or NIH, but it is going to certify. In the same way, in the other countries, there are bodies who are going to ensure that the vaccine is really ready to come in the market. And once it is ready, there has to be companies who should have the factory or the manufacturing possibility where they can manufacture this medicine, and finally the production starts. So this whole process is normally going to take 4 to 5 years time to bring up a standard vaccine to the mankind. But in this case, since we are running short of time, so the timeline is very critical. So we are working on the speed. So since we already have seen SARS and MERS, which are the similar kind of virus, which is like COVID-19. So we already got the advantage of studying their nature and the kind of character. So that definitely the scientists have already studied, and the entire medical fraternity, they're working on this vaccination. Now in the phase 1, we have already said that phase 1 already we have started and the phase 1 is over. Now most of the companies, they claim they are in the phase 3 level, and already there are companies who have got their manufacturing facilities ready so that once they get the approval, they can start immediately doing the production for these doses so that it is very soon available in the market. But so far, the fastest vaccination which has come is basically 4 to 5 years. So you can understand that we have a very short span of time, and we are still confident it is going to come not before 18 months, because maybe by the time when we are talking about August or September, it will be able to get the approval from the government body to be notified that this vaccine is ready and to get manufactured, and finally to bring in market. It is going to take maybe the next summer, so that we can see this vaccine is available. Maybe till next 2021 February we can see this vaccine coming in the market. But for this duration, for this time, we have to stay safe, and we have to really follow the protocols which we have been following, and we have to understand that this is a complete scientific process. It is not a kind of magic which is going to happen overnight, but by creating awareness, and we have to be patient. We also have to respect the protocols for COVID-19 so that we can really stay safe and we can stay healthy till the time we don't have the vaccine with us. But we have to understand that the kind of vaccine which the Oxford University is working on is ChAdX1N, which is a kind of virus which is normally also known as chimpanzee adenovirus N1, which basically is a kind of virus which causes cold flu in chimpanzees, which is basically being tried out, and they're very sure with that particular antivirus they can really treat this COVID-19. They are working in collaboration with AstraZeneca. In the similar way, Pfizer also claims they have already completed the phase 3, and they are also bringing in their virus. There are several viruses like antiviruses which are coming in the market, some vaccines like mRNA. There are basically some other companies who are also very close. So let's hope for the best, that we are going to see a better tomorrow very soon when the world will be free from COVID-19. But we still should be safe and follow the protocol, because we must know that ultimately the safety security is in our hand, and if we really strengthen our immunity, then we can still buy some more time for us till the time we have the vaccine for COVID-19 in the market. And if you really want to get more answer on immunity, then I would give the link of my previous video on immunity, and you can go through that video so that you can understand that how exactly we can really develop our immunity. So that's all from now. Thank you. I believe you have enjoyed this video. I will be back for one more such interesting video. Till then, goodbye, stay healthy, stay positive. Bye-bye.